Okay, let's see. Hello Ravi, welcome for the session. We'll begin soon. Sir will join us in 5 minutes, then we'll start the session. So, like, if you all have any questions, you can ask in the question section. Hello everyone. Thank you everyone for joining. So, how are you all? If anyone has any queries, they can ask now also. Hello Akash. Hello Sujit. How are you? Like we have started this Insta live sessions from today only, so we are planning to organize such sessions every week. Hello Sneha man, thank you for joining. So guys, we hope that you are just learning a lot and enjoying our session and all the posts that we do for you all. So if you will have any suggestions regarding what to organize, how to organize, and any topics that you like, we can just we'll be happy to oblige. So if you have any suggestion, you can give that. I think sir will join in 5 minutes. Hello sir, you can send me the request so that I will add you. Hello sir, good evening.
Good evening, good evening.
Sir, how are you?
Yeah, all good, all good. Yeah, am I audible?
Yes sir, you're audible.
Okay.
I think my earbuds are faulty. So how are you doing sir? How was your trip?
Yeah, all good. Trip is still going on. So another half an hour I have to travel again. So that's why.
Okay, so hello everyone. Today we have with us Professor Dr. Ankit Bhargava. He is a director and professor at Faculty of Physiotherapy and Diagnostics, Jyoti Vidyapit, Women's University. He is also an honorary professor at Exeter University, United Kingdom, and also professor, director, and founder of ABHIAHS. Like we have done collaboration with him, and we'll be bringing lots of new courses along with him for you. So, sir, I welcome you. Thank you for giving us time from your busy schedule.
Thank you, Bilal. And it's my privilege to, do some collaboration with you guys because basically my always having a target, so to provide the quality education in physiotherapy to everyone around the world. And little bit, I wanted to, before starting the session, I wanted to give you some, brief information about Abhyas to all the listeners, viewers. So basically, I tell you, Abhyas is a first and only institute of India, which is approved by various US boards and UK board for their credentials. And we only we deal in authentic certifications and diplomas, which is exclusively designed for the physiotherapists and allied therapy professionals and psychologists so that they can whenever they go for a foreign university or a foreign license exam, so normally they have to cover up professional credits every year, some professional credits, and each and every professional credits is equivalent to approximately around $1,000. I came up with this idea. So where uh, due to because I have done a lot of hard work in my life, so my profile is too big. So on that basis, I took a little advantage in US boards, and I got the approvals for 30 credits. And I'm also designing some diploma courses for physiotherapists so that they can uh, uh, they can well versed in diagnosis and the latest advanced techniques, because still in India the physiotherapy is on the olden age, where they focus on electrotherapy, and they focus on same diagnostic system on the basis of MRIs and X-rays. So I wanted, this is a dream of me, where each and every physiotherapist of India is able to diagnose the exact situation, because we are a human engineers and we should know about the body, each and every part of a body, where you can diagnose even a single small thing in the body. So that's my vision, and that's how this Abhyas started. And many of we also have a app, Abhyas app, on the Play Store, so they can download it. And I keep on providing them certification online and offline courses. Right now we are providing near about 300 online courses, and offline courses I'm going to start soon, because I'm in a last stage of a curriculum where it is getting approved from the US board and as well as the UK board. So soon is going to start a diploma, which covering all, each and everything from the basics till advanced. It's going to cover. Okay, so this is a brief about Abhyas, and we are running short of time. So
Yes.
because I also wanted to give you some 10 minutes time to ask your questions, so I'll take 15 minutes approximate, and then I'll tell you, I try to give you the clear picture about stretching. That is the topic of today. And so that you clinically as well as theoretically, so that you have a complete detailed idea about the stretching. And then last whatever 10-15 minutes what we have, in that you can ask questions regarding to your stretching, or any type of questions on your career on physiotherapy. Okay, so
Oh,
Bilal,
definitely.
I just wanted you to collaborate with that question thing, because people keep on typing their question on the comment box. So you can type it off, but you make sure that you take care of that question, so that at last we can cover them all. Okay.
Yes,
So
definitely. We also have a question section in the down, so they can type their question there also. Question will be there at the question section.
okay. So before getting into the stretching, see, I just wanted to ask you all how much you think that stretching plays an important role in your rehabilitation process. So any one of you, or any one of you wanted to wanted to give this answer, because how much stretching has an importance in a rehabilitation and the injury prevention or injury recovery. So anyone can answer in 1 or 2 minutes fast. uh, I think uh, it takes time to do that, but anyways, I'll tell you. See, basically, let me start with the stretching. What is stretching? So basically, any muscle or tendon stretched or flexed, that all the movements, I tell you, the people think about like stretching is very tough, and many of the physios on third year, fourth year, they don't even know how to do the stretch. I give you the simple procedure for a stretch also. But before that, the stretch is basically a flexion, like extreme flexion or move, that stretch of any muscle or tendon. That is whole thing is stretching. Okay, so basically, if you wanted to do a stretching and you wanted to learn a stretching, it's a simple way. Just see the movement of your joint. Like, let's say, for example, uh, in neck we have flexion, extension, lateral, middle rotation. So what you do is, in a flexion, you just move your head till the end. You feel that, okay, till the time, now the neck is not going down actively. Now what you do is just press it downwards, give a little bit 5 degree pressure, little bit pressure, and move the 5 degree of that particular joint. You will feel the stretch. Okay, so even the angle also matters in a stretching. Even your 5 degree movement or your 10 degree movement will change the course of your stretching. Okay, for example, if you wanted to know, like, if you do flex your neck in a actually a 90-degree angle, you will feel the whole stretch in the middle back, middle neck, and little bit towards your thoracic. But if you little bit tilt your neck while stretch another 5 degrees, so you will come up the stretch on the lower fibers, and then you goes into middle and upper fibers of trapezius. So that's how the even your 5 degree of your movement of a joint will gives a different angle of your stretching. Okay, and secondly, any of the joint, you just see that joint, which movement it is, and just overstretch that particular movement. You will get the stretch of that particular joint. So that is a practical aspect in a simple way where you can do a stretch. Okay, now there are two types of stretches, which is a static stretch and a dynamic stretch. Static stretch, what we do as a physio on the field, like many of you have seen on the TV, where anywhere where there is a problem while on the field. So we, especially in a hamstring and quadriceps. So in hamstring case, we keep the leg on the shoulder and do the stretch towards the player. So that is the stretching, which is doesn't include any movement or your own movement. That is a static stretch. And dynamic stretch is basically the stretching with movement. Okay, so basically you have sometimes we do our own stretch with a movement. So that is a dynamic stretch. And again, it comes as an active stretch and a passive stretch. So as you all know, that active movement is basically a movement which is done by own, or by the patient by their own, where the therapist doesn't touch the patient, he just instruct the patient. Okay, and the passive stretch is basically the therapist do that stretch to the patient or a player, whatever. So that is a passive stretch. So basically, a small scenario, if you see a summary of whole stretch, is basically you have an active and passive stretch, you have a static and dynamic stretch, and the movement of a stretch of a joint above the end feel of that particular joint is all become as a stretch of the muscles. Okay, so that is the complete scenario of a stretch. And now it comes to the practical aspect, where I told you in a practical aspect that stretching is very important, because if you don't do the stretch, the recovery of a patient will become low. And another thing, research also says that 80% of your back pain comes from the tight hamstrings. Okay, so uh, while assessing the patient in your clinical practice, you should always focus on the stretch, like the flexibility of a patient, because sometimes the patient comes with a back pain and the pain is like this is that, oh sir, 1 year, 2 year, 3 years I'm having a pain, but you simply do that hamstring stretch, the patient feels good, and suddenly patient says, oh sir, my pain is gone. So even, and nowadays the scenario is like many of the people, many of the physios, they focus on chiropractic, which is nothing but it's a manual therapy of a physiotherapy. So in that manual therapy also, sometimes if you want to receive, you want to get a good result while giving a manual therapy, better first give the stretch, give a proper stretch of all the muscles, lower joint muscles, and then you do the manual therapy. You will get a, you know, beautiful result in a patient. And the patient do what, if in case, like without stretch, if you do the manual therapy, sometimes you get only 20% of relief, but if with the stretch, definitely you will get a relief of more than 50%. So this much is the difference when you use the stretch in your, you know, clinical practice along with your other techniques. Okay, so now when it comes to the on-field recovery, stretching plays really important role, because as you know that before going to any of the game, we basically go for a warm-up sessions and the cool-down sessions. So basically, if you observe the cool-down sessions and the warm-up sessions, is nothing but maximum of the cool down and warm up session is consisted of your static or dynamic stretches. Okay, and then the other movements of the body, which is a basically a, it's a initial phase to make the muscle warm before the stretch. And once you do the stretch, the player become more flexible and more relaxed, so that he can move his joint more than his capability. Okay, so that is one thing. Now I'll tell you the important and a, you know, shocking part of stretching, use of stretching. See, many of the people, they go for a, you know, weight loss. Okay, and suddenly they just use the gym equipments and running and whatever. If you do the stretch before any of your activity, the result will be 25% higher than what you get without the stretch. Okay, so I'm not saying this, I'm saying this as per on my experience, but you should follow this instruction and just follow this in your clinical practice. You will see yourself the result and let me know. Okay, so this is how the stretching plays an important role in our body. Now, sometimes you see that there is a trigger points developed in a patient, and due to that trigger point, we have a pain. So in that also, if you specifically, for example, if you have a trigger point in your piriformis, that piriformis trigger point will definitely confuse you with the sciatica pain, with, you know, with your back pain. You keep with the, you know, orthopedics, they will definitely tell the patient to go for MRIs, and MRIs you will feel or see that, oh, it's a compression, but sometimes the compression is not there. And you know, just a simple trigger point release with the stretching will help the patient to recover so fast, where, you know, you sometimes you feel that, oh, surprise, why the how the patient get recovered so soon. So this is how stretching plays an important role. Even you know, sometimes you have a pain ready towards your knee, but it is a problem of your IT band. If you stretch the IT band, your knee pain gone. So it happens. So that is why I always say to the students, focus on your basics. And what are the basics? Basics is your complete assessment, your stretching, and your, you know, your assessment towards your patient's water intake, minerals intake. So that will all, because that all things will affect your muscular structure. And then it also definitely affect on your other parts of your body which is attached to that muscular structure or tendon structure. So I believe I have covered maximum of the important points as in your clinical practice as well as your the study, as well as your degree wise practice. So basically, I think this is the most important areas of stretching. If anybody having any questions, they can ask. You have still have 10 minutes time, so you can ask.
So like most of the students they ask like what are the indications and contraindications of stretching because where
Yes.
should they use, where should they not use it because that is quite important
Yes.
in the field.
Yes. See, first of all, indications, of course, whenever there is you feel that there is a lack of flexibility in the patient, if you feel that there is a tightness in the muscle, if you feel that there is a cramp, or if you feel that there is a pull while playing the game. Okay, so immediately you apply ice while game. Suppose you have a pull, immediately apply ice with the stretching. So you can do the combination of these two things, and you will get a good results. But again, it comes to the contraindication. So of course, but if there is a open injuries, if there are high fever, then if there is a immediate injury or hit injury, maybe the patient fell down on the bone, or if there is a good swelling, and like any kind of hit injury or road traffic accidents or something. So in that case, you should avoid the stretching because already, and also in the grade 3 above any tier, okay, you should not do the stretchings because already the fibers are out, and if you do the stretch, there are chances to it will come out properly. So let the patient heal first in a severe conditions, severe injuries, and then start stretching slowly. Okay. Yeah.
Okay, sir. And so one the new prevalent technique that is cryo stretch. What's about that? Like
Cryo stretch,
where should
yes.
we use it, and how it is, whether it is more beneficial or less beneficial, or what is its main objective?
See, that's what immediate. Just now I told you, in olden days, what people will do is like they do they put the ice when there is a pull, and they do the stretch. So that was the olden method. So nowadays you have a cryotherapy, machine is there. Yeah. So with the stretch you can apply the ice. So basically the basic funda is you have to combine the ice with your stretching on the same time.
Okay, sir. Thank you for that. I
Someone has
think
told that, sir, can you just save this live on your page, please? So, Bilal, just be careful with this.
definitely we'll save
Save
it
this,
for your
save this
future
live.
references.
Yeah. Yes. Yeah.
And if you have any questions, you can ask,
Ask.
or if you want to join us, you can join us in the live session also, so that you can ask the question directly. Because we still have like 10 minutes with us. So if you have any questions, you can join us or you can ask in the comment section. I think it was a very
Anybody
short,
having any
crisp,
question,
and quite
they
descriptive
can
session,
ask.
sir.
Because, see, I always
Yes, sir.
believe, you know,
We got one. No, sir. We got one question.
yeah.
Sir, I want to know what is the advanced protocol of stretching in ortho, neuro, and sports PT?
Ortho, neuro, and sports PT. See, basically, stretching is same for all. So sports, whenever there is an injury, so depending on the injury, we do the stretches. But stretching is just a stretching. So there is no protocols as such. But yes, it is given as per the condition and as per the requirement of the rehabilitation. So there is no access fixed protocol, but it's just a stretching.
And one question is from Imran Ali. Sir, frozen shoulder में stretching दिया जा सकता है क्या?
बिल्कुल दिया जा सकता है बिकॉज आप ये समझो कि फ्रोजन शोल्डर इज व्हाट इट्स बेसिकली आपके शोल्डर जॉइंट को बहुत आपकी मसल्स काम नहीं करने की वजह से या शोल्डर जॉइंट के अंदर गैप खत्म होने की वजह से यू हैव दैट टाइटनेस, राइट? तो अगर हम उसके सराउंडिंग मसल को स्ट्रेच करेंगे तो डेफिनेटली द जॉइंट विल गेट अ रूम, एंड व्हेन द जॉइंट विल गेट अ रूम योर मूवमेंट विल इंक्रीज इमीडिएटली। बट एक चीज ध्यान रखो, combination of your MFR along with the stretching will definitely help you faster in frozen shoulder.
Okay, sir. Next question is from Astha. Sir, can taping be used for stretching? Taping or tapping?
Yes. See, basically, this is tapping or taping. That's just clear this.
Yeah. Astha, can you just clarify? Is it taping or tapping?
Because tapping is a massage technique and taping is a normal taping, you know. So it's a kinesio taping and other taping. So I just wanted to clear this thing. This is a tapping or taping. Tapping is you just tap 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 tap. You do it on while doing a massage. That is a tapping. And taping is basically, I give you the both answers. Okay, tapping can be used for stretching. Definitely you can use it because while doing the stretching, anyways, we are actually relaxing the muscle. So if you do that tapping, it will. Now it comes to kinesio taping. See, kinesio taping is always used on stretch muscles. So there is no point where there is no point of not using kinesio taping in stretching, because the basic function of kinesio taping is work on the stretched muscle. So once your muscle is stretched, then only you can do the taping. Then only it will give you a good result. So definitely, yes, you can do it. Kinesio taping, and beautiful. It's really worked beautiful because I'm using this taping from past 15 years, and I'm the oldest kinesio taping practitioner and also the Kinesio India head. So I know how wonders taping can do. So we keep on doing the researches with the Dr. Kenzo Kase, who is the inventor of this taping. So we have seen results on on not even on the humans. We have seen the results on the horses also. So that is the thing. Yeah.
One more question, Imran Ali. Sir, frozen shoulder stretching करते टाइम पेन हो सकता है?
बिल्कुल होगा। पेन, देखो, पेन से डरना नहीं है, क्योंकि देयर इज नो गेन विदाउट पेन। तो जैसे जहर को काटता है, वैसे ही पेन को काटता है। तो डेफिनेटली स्ट्रेचिंग करते समय पेन होगा, मगर बी केयरफुल व्हाइल डूइंग द स्ट्रेचिंग, द लिमिट एंड फील ऑफ योर मसल एंड जॉइंट, बिकॉज बहुत लोगों की फ्लेक्सिबिलिटी बहुत कम होती है, और अगर आप ओवर स्ट्रेच करोगे तो डेफिनेटली देयर आर चांसेस फॉर द पुल और देयर आर चांसेस फॉर द डिसलोकेशंस। सो मेनी थिंग कैन बी हैपन। सो वो ये तुम्हारा पॉसिबल है, देखना होगा कि पेशेंट का कितना पेशेंट लोड ले सकता है, उतना ही करने का है, एक्स्ट्रा नहीं करना है उसको।
So जैसे पेन मोस्टली एक इंडिकेटर होता है कि we should stop at certain point. So what is the
Yes.
difference like between stretch pain and if there is like an athlete, कोई एथलीट मेरे पास आया, स्कूबल में क्वाड्स में स्ट्रेन हो गया है, तो उसको अगर हम स्ट्रेच दे रहे हैं, पेन आ रहा है, तो कैसे डिफरेंशिएट करेंगे वो स्ट्रेच पेन है या फिर स्लाइट मसल टियर या कुछ कंफ्यूजन कुछ हुआ?
उससे पहले हमको ये चीज जाननी होगी कि पेन 22 तरह के होते हैं, ठीक है? हम पेन को जस्टिफाई करते हैं उसके तरीके पे कि पेन शूटिंग है, थ्रॉम्बिंग है, या ऐसा बहुत अंदर अंदर है, या कैसा है। तो दैट इज द रीजन हम पेशेंट से पूछते हैं कि भाई आपका पेन कैसा हो रहा है। अब ये अंडरस्टूड वाली बात है कि अगर मेरे प्लेयर को इंजरी है ना, और वो इंजरी ऑन फील्ड इमीडिएटली हुई है, तो सबसे पहला काम तो बॉडी ही तुमको बता देगी कि कितनी भयंकर इंजरी हुई है, क्योंकि वो अपना रिएक्शन दे देगी। एंड उसके बाद पेशेंट चल पाएगा नहीं कर पाएगा वो तुम्हें खुद पता चल जाएगा, और उसके अकॉर्डिंगली यू हैव टू टेक द कॉल। दैट इज द जॉब ऑफ फिजियो। सेकंड थिंग, जब पेशेंट की इंजरी नहीं है और जब हम उसको स्ट्रेचिंग कर रहे हैं, और स्ट्रेचिंग करने के बाद उस हर इंसान का अपना एक लेवल होता है हील, मतलब उसको सहन करने का, वो अपने आप बता देगा कि अरे डॉक्टर साहब मेरे को ऐसा पेन हो रहा है, डॉक्टर साहब मेरे को बहुत पेन हो रहा है। तो जितना भी है उसका जो भी है इमीडिएटली स्टॉप करो। उसको ये नहीं करना है कि भाई नहीं हमको तो स्ट्रेचिंग करनी है, नहीं, वो स्लो एंड ग्रेजुअली, क्योंकि ग्रेजुअली कोई भी चीज की जाएगी the results will be much faster. Okay, so that you have to see the signs, physical signs of the body along with the patient, patient क्या आपको response दे रहा है, उसके according you have to work it on.
Okay, sir. Anshuman is asking, is there any chance for taping webinars someday?
Yes, we will. We can definitely do it because I'm the master of taping. So जो taping मैं सिखा सकता हूँ वो taping कोई नहीं सिखा सकता because I have done lot of taping on women's health also और काफी wonders किए हैं. That is the reason on that work only. Oxford University. Actually, he told you the wrong information that University of Exeter, but I am the I am the honorary professor for Oxford University, Exeter College. So Exeter College actually comes in Oxford University. So I'm the professor of that, and because of my work on women's health and on the taping, they have offered me the honorary professorship in Oxford University. So that's how it is. So definitely we can definitely one day we'll plan, and Bilal will take care of that thing, and definitely we'll plan for your one day
Soon we'll be
one
organizing
webinar
lots
on
of
taping.
online and offline both. Both the courses will be organizing soon. That's why we have done tie-up with sir
Uh, and, and
because
and and
sir.
and also we will also planning for a proper certification with the new techniques which in a taping, and we'll definitely come out with the offline courses soon, and so that the people will learn the best taping and they can get a good results in their clinical practice.
Definitely, sir. We'll definitely go into our offline and online both the training programs soon.
Imran, the problem is the in setup where I'm sitting right now, I cannot perform the things practically, but definitely this is not the end. We will definitely because again I have to leave for catch my flight, so I have to leave in another 5 minutes. So what we will do is we will definitely plan a detailed or 1 hour session on this where I will be performing live on the stretching in my clinical setup so that you guys will able to understand better.
Yes, sir. That will be great. So
Okay.
maybe by the end of this November or in the starting of December, we'll organize an online webinar on stretching, so that where you can explain it with different techniques. What is cryo stretch? How can we do stretch using the bands and
Yes.
different instruments? That
Because
will be very
yeah,
helpful for the students.
one before going, I wanted to give you also one more information on stretching. The stretching can be performed with many ways. You can also use your foam roller. You can use your TheraBand, stretch bands. So stretching can be performed many ways. And definitely, I'm going to take one more session on stretching, a practical demonstration session where you can able to learn and how to use these bands with your stretches, with your stretching protocols. Okay. Yeah.
So just one last question. What is? Can you explain in short what is ballistic stretching?
So
Ballistic stretching.
ba- ballistic stretching. See, basically, even all these kind of techniques, whether it's a ballistic, whether it's a foam rolling, anything, whatever. See, basically, it comes under fall. That's what I tell you. Do not focus on the building. Focus on the basics, and the basics of stretching is static stretching, and dynamic stretching. Okay,
Dynamic
so
stretching.
basically, if anything with the movement, and if you use any kind of outer protocol like stretch band or foam roller, whatever product you use it, that actually only affect on your muscle in a different way, but it comes under dynamic stretching. So basically, whatever ballistic stretching or your foam rolling stretching or your stretch band stretching, all comes in a dynamic stretching. So but the ultimate goal is you have to stretch the muscle, which you can do it by your hands also. So do not go get into the fancy words, and this is the basics of stretching.
Okay, sir. Okay, sir. Thank you very much. You might be getting late to catch a flight. So see you
Yeah.
soon in
So
India.
I'll see you guys again. Yeah, definitely. Definitely. Yeah. Okay. Bye
Okay, sir.
bye.
Okay, sir. Thank you, sir.
Thank you. Thank you. Bye bye.
Thank you, sir. So, guys, we are ending the session right now. I'll be joining with you shortly to take your questions. And thank you very much for joining it. And do follow our page, and we'll come up with regular webinars and sessions.